went from the bonnet, found face down on the floor.
2, 3.
Paediatric trauma
It's a stabbing quadrant.
25 feet from a ladder onto his back.
He's really unwell. I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
King's A&E, how can I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life, and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
King's A&E. 59 male.
Adult stroke, 10 minutes, adult stroke, 10 minutes.
King's is a specialist stroke centre, one of only 8 in London.
Stroke registrar?
That's right, yeah.
Each year, King's treats around 1,300 stroke patients.
I'm now aware.
On our stroke unit at King's, we assess 4 or 5 fast calls in a 24-hour period, some of which will turn out to be strokes, some of which will initially look like strokes, but we may decide that's not the case.
This is Charles. Charles is 59 years old. Collapsed twice at midday today. He has no recollection of this. His wife was called to come and get him. He was assisted home.
Okay. Stroke disease is one of the biggest causes of death in the UK, but certainly amongst adult populations, the biggest cause of disability. Your wife, is that right?
Yeah.
And I presume you weren't present at all?
I was not.
No.
When I came in, he was different. He was slower, he was slurring, he was not the way I saw him when I was going out.
King's have a clot-busting drug which can vastly increase a patient's chance of recovery, but only if given in the first 4.5 hours.
In strokes, time is really important. The earlier we can give those treatments, the more effective they are. And there comes a point after the start of the patient's symptoms when those treatments become ineffective and possibly dangerous. Hi, Charles. I'm James. I'm one of the doctors here. And I'm going to do some tests of your nerves, all right? Next thing is just look at my hand here. Look at my hand. So follow it this way. Follow my hand this way. And then over this way. Now touch my finger, please. Touch my finger. Touch my finger. Okay. All right. Okay. Okay, that's good. Can't really find anything. I don't think we're going to thrombolyse him, so try and work out what's going on. The ambulance group brought him as a possible stroke. I don't think it is a stroke, but obviously something's going on, so we'll try and work out what that is, okay?
Hello, Remo, it's Claire. Have you got another space? As soon as I can try and create some space, we can bring this one back out, but all my bays where I need to see people are all taken.
Once when we were about 15, we were at Pizza Hut and we really fancied this guy on like another table. So we wrote our numbers on a napkin and asked the waitress to give it to him. She gave it to the wrong person.
How old are you?
Was it at the same table or? No.
Hello, it's Claire. Have you got a bed?
One sip of tea. Very hot.
I'll wait for it to cool down a bit. Thank you.
Anything happening?
Not at the moment, no.
Hello, Kings, any recess? Yeah. Thank you, bye.
Adult medical 3 minutes, that's adult medical 3 minutes.
72-year-old Laura is being rushed to King's, having suffered a suspected stroke. Her husband Camillo is driving in behind.
I was down here in the kitchen, and she came down about around 9 o'clock, and she made herself a lemon tea. That normally I always take the lemon tea up to the bedroom. She went back upstairs to bed. After 10 minutes, I went upstairs to get ready to go out. I saw her standing in the bedroom, and I said to her, "Are you okay?" And she couldn't talk. She had a piece of paper and she wrote, "I think I have a stroke." Then I phoned the ambulance.
Stroke over here.
Okay, this is 72-year-old Laura. At 9:15 this morning, she's had sudden-onset of slurred speech. Heartbreak.
Hello, it's Laura, right? I'm Fiona, I'm one of the nurses. So your speech gone? Yeah. Yeah? I know you want to say the words, but you can't, right? Yeah. Okay.
She must have been desperate to make people understand what she was feeling, but she couldn't.
Okay, it's gonna be okay. You're in the right place, all right? And we'll take good care of you. Yeah, is that what you were trying to say, your husband? Yeah. Okay, okay. Once he gets here, we'll let him know where you are, okay? And he can come. Yeah.
Jenny, I'm one of the neurology doctors.
Hi.
How are you? Don't worry, we'll try and look as to why that is, okay?
Doctors will scan Laura to find out if there is a blood clot on her brain.
Can you have his leg up for me?
We've got a husband here, shall I put him in?
No. It was terrible. You see somebody that they cannot talk things like that, you think always are the worst.
Sorry.
Laura is being rushed to the CT scanner to confirm if she's had a stroke.
Watch the cord there. Thank you. Everybody ready?
We met in the city. She used to work in a bar, a wine bar. And I used to work in a snack bar, to work for the same boss. So I went there to see the boss, and I saw Laura at the door on the way home. She had a fantastic body, good shape, you know, like men like. And so I said to her, "Where are you going?" And she said to me, "I'm going home." So I said, "I give you a lift." I said, "With the bus, because I haven't got a car." And she thought I was a bit simple, and she went. A couple of years after, we got married. She was about 31. She was divorced. She had one daughter, Gabriela, or Gabi. She's here.
Do you want to come and say hello? Hello, Dr. Marijorie. Stroke doctor. It's okay, don't get upset.
Oh, because she's so...
Okay, let me just take you out.
Laura's daughter and grandchildren have come to see her.
Hello, darling. It's a joke.
Oh, well, at least you can still talk.
No, can't. Oh, good, and I do too. And I do, and I do.
My mother brought me up on her own from the age of 2. She loved taking me to the circus. We'd go to the park. Battersea Fun Fair was still around, so I remember going on the rides with her. Trips to Brighton in the evening for some obscure reason. She'd always bundle me into the car and we'd go down and get fish and chips from Brighton. Shopping, lots of shopping. She had this habit of buying these lovely Italian booty things that would go up the ankle with these frilly ankle socks. Patent, red patent, black patent, anything that was shiny. I had fun with my mum.
Speak to the doctor.
'Have you guys seen Django Unchained?
No.
I really want to see it.
Timber went to go and see it.
We should try and...
Thursday.
Is it still in the cinemas?
Yeah.
We should try and go. There's a really good song on the soundtrack. It's just been in my head all morning. It's really good. My dad saw it and said it was like every other word was like not a nice word. Really? Yeah.
Where did you have to go for the tea?
Round to the main entrance.
Oh.
You know, that cafe just inside.
Oh, yeah.
By the blood place.
Yeah.
"47-year-old father of 3, Nick, has collapsed in reception. He's being rushed straight through to resus. Nick is the national BMX champion in the over 40s category. He's fallen 20 feet off his bike while performing a stunt during training.
It's in the morning, it's just a normal training session.
I was like somewhere behind him when he did it.
Oh, right. I just heard a bang.
Yeah.
And looked over and he was just on the floor.
Get me your collar, please, a regular collar. We've trauma called this patient. Basically, mechanism of injury on a BMX bike, flipped up in the air at 20 foot, he's fell off it. Left-sided severe chest pain, and his wife's brought him up, so we're going to now collar him. How many layers?
He seemed all right. He managed to get up and walk over to a chair and go and sit down. While Mum said it was kind of when he got to the hospital that he was suffering.
Hi, Nick, I'm Lara. Yeah, sorry, that was Matt. So I'm Lara, I'm one of the trauma consultants. Because what's happened is you've triggered a trauma call, essentially, because of what's happened to you. So a lot of people are going to arrive, OK? And we're going to do things in a very structured way, which you may find frustrating, but you just need to bear with us, OK?
Certainly when they come to majors, people think they're unwell, but sometimes people don't realise how unwell they are.
When you're ready, we're going to need to get you to lie down, essentially. Do you need any painkillers, Nick? Okay. You haven't had anything yet, have you?
No, nothing.
You have to be a bit careful of your mindset because you sometimes presume if somebody's walked in, and certainly for staff around you, that they're probably going to be better off than someone who's kind of come in collared and boarded. And you have to be careful not to presume too much, really.
Slowly lower your start lowering yourself down.
Sometimes the injury doesn't look as bad on the outside as it does on the inside.
So okay now.
Where's it?
All the way down on your back. Okay. Right left side. My chest.
Let's get some monitoring and stuff on you. Sorry, Nick.
Have trouble breathing, Nick?
Yeah. When
Okay.
when it was first half an hour, it was gurgling.
I started BMXing in 1979. My brother and I were on holiday with my parents in Cornwall, and we walked into a Halfords bike shop. There were these amazing bikes that we'd never seen anything like. We used to thrash our old choppers and grifters around the woods, and then all of a sudden there was these purpose-built bikes from America. And they had a little magazine, a sales magazine that went with it, and we took them and they became our Bibles. So from August to December, when Christmas came round, that's all we did. We just talked about this bicycle motocross, and our parents bought us bikes for that 1979 Christmas.
Okay. And what happened? Did you get up by yourself or somebody help you up? Or?
I couldn't get up for about 10 minutes.
Okay.
And I felt very sick.
Okay.
And dizzy.
Okay.
And I couldn't breathe, I'd winded myself. So.
Okay.
BMXing, superb feeling. There was a game we used to play when we were kids, which was the Star Wars video game. And there's that thing where you hear that voice in your head and it says, use the Force, Luke, and he's going down the tunnel. And you get this kind of peripheral tunnel vision. That's what it's like. You're kind of in a zone and your peripheral vision is taking over control and you're just going for it, 150%, just absolutely charging and racing against other guys. That carried on until about 1986 when I went to do my degree. And went back to BMXing about 6 years ago when my two sons got really interested in it.
Okay, so the way it works is the lovely Neha is going to put a line into your arm and we're going to do some bloods. Yeah. I'm going to get some paracetamol into that drip, but we'll also give you some morphine just to keep you ticking over, all right? Yeah.
83-year-old Marjorie has come to King's with pain behind her eye following a recent bout of shingles. Her husband David has brought her in.
Did they say anything about the eye?
No.
Hmm? No. What you got there? Sandwich.
Yeah, she looked at it.
Hmm?
She looked at it, but didn't make any observation.
Yeah.
They're sure it's nerve.
Hmm?
They're sure it's this nerve group that's causing the pain.
The what?
Nerve group.
Nerve group.
I was in the Air Force when we met. I was on leave. I'd just come back from Malaya. So I was as brown as a berry. And unbeknown to me, Marjorie had seen me in Sydenham in a sweet shop. Do you want a sip of tea now?
Be nice, thank you. What did you eat? Sandwich. What did you eat?
It's a sandwich. Do you want a bit?
No. Something. What is that?
It's a BLT.
No, thank you.
When I first saw him, he was very tall, very tan, in his uniform. And I'd always liked men in uniform. And I thought, wow, he's a bit of all right. If I saw him in the road, I would follow him along and go in any shop that he went into and hope that he would notice me, and he never did. And I thought, well, is he worth waiting for?
How are you, Marjorie? Hello, OK, thank you. Any better? It comes and goes in waves. Comes and goes.
It was really the dogs that brought us together.
I had a dog, Chum. She saw me cross the top of her road, so she dashed back indoors, got her dog, and came up the park to be there at the same time as me. She was very slim, and she had lovely legs, And she walked in a very specific manner of walking. She used to sort of swing one leg round in front of the other as she walked. And it was very sexy. It was really. My dog got naughty with her dog, and I had to sort of intervene, and that's where we started.
What we're going to do, we are going to give some tramadol. Have you had tramadol before?
Don't think so, but
No, I don't think so.
Tramadol, okay.
Okay.
Right.
Thank you. Did you hear what he was saying then?
They're going to give you a cyanide pill.
Yeah.
Patience, isn't it?
Just tell me what it is.
Yeah.
It's a stroke. It's a stroke.
Yeah, it's a stroke. That's the diagnosis.
Yeah.
And the stroke has affected what we call the understanding and speaking component. So her speaking isn't so normal.
It's difficult. It's difficult.
Laura's CT scan has revealed a blood clot on her brain.
A small stroke.
To reduce the risk of permanent brain damage, the stroke doctor is giving Laura's family the option of administering a clot-busting drug.
When somebody comes in so early on from the onset of a stroke, we have the ability to give a clot-busting drug. People who get it, compared to who don't, have far less disability a few months down the line. The disadvantage is the risks of bleeding. So although it's good to break down the clot, in this world you almost can't have something for nothing. The risks of bleeding are lower than the benefit. The risks of bleeding are around about a few percent. And low. Those people
The chance of developing serious side effects from the drug is less than 1%.
But there's no point. I can't say to you, it's all good. There's no problems.
Yeah.
That's not right. That's not fair. That's not the truth.
We only use one type of clot-busting drug, one type of thrombolysis drug at the moment. By giving those treatments, we hope that we can restore blood supply, thereby stopping any damage to brain cells. But there are downsides because you're cleaning the blood, and some patients will bleed into the brain, and you really do have to pick it for the right patients. You do have sort of definite stroke pathology. More patients do better than do badly.
I just need to say my head is just all over the place. So you've seen the scan and there's definitely a clot.
We know that because you
Yeah.
can see the stroke symptoms. She was normal, regular tea coming up to bed. You don't have a huge amount of time to think about it, but have a few minutes to talk about it. Or do you want to ask me any questions?
You feel that you are hopeless, that really you cannot really decide. You're pushed to decide which way to go, but it's very, very, very difficult. Or you don't know if you make the right decision or the wrong decision. That is the problem.
What do you think we should do, Lily? What's the first option? Nothing in a speech stays like that. Okay. Or the clot-busting drug.
I'm Fiona, one of the nurses. I'm going to give you a little bit of morphine for the pain, okay?
So we have 46-year-old national BMX champion who's basically gone on his bike, about 20 foot into the air, has gone over the handlebars, landed on his back, on his head and his back, essentially, complaining of neck, back, pain on scene and a bit of chest pain. Was winded, said he couldn't breathe, so his wife scooped him and brought him up. So should we call his other half in at some point? Nick, what's your other half called? Maya?
Yeah, he's not what you'd expect of a 47-year-old man.
Yeah, he
going 30 miles an hour on a kid's bike.
Yeah.
Around a dirt track.
How does it feel to be like the oldest teenager in town?
I love it. I love it. I love riding my bike around the street and have other people kind of, whoa, what's he doing on a bike that kids should be riding?
Hi, I'm Maya. Hi, I'm Lara, one of the trauma consultants. Hi. You come in, they're just about to do some x-rays, so if they do, just kind of pop behind one of the screens.
My wife's a good athlete. She's always been a good athlete. She's a fantastic ice skater, but she also quite often, I find her just coming back from A&E, putting stitches in her chin where she's fallen on the ice. It's not unusual for us. My wife's got all the insurances in place, and I'm not joking.
Hurting everywhere.
She's given some morphine, so it's a little bit better.
Are you still hurting everywhere, or is it somewhere specific?
It's really just like ribs, chest. Quite dramatic, isn't it?
Nick's x-rays have revealed that he's suffered internal injuries.
That's okay, a couple of things. You've punctured your lung. So what we're going to need to do is put a drain into that side to allow the lung to re-inflate. The other thing we're going to do, because we found that, we weren't expecting to find it, I think we just need some better imaging. So we'll get a CT done of your chest, your abdomen, we may as pelvis as well, and just check, because you've obviously had a significant injury, so I'm afraid you're going to be with us for a bit longer than you anticipated. Okay? There's worse places to be.
I'm going to have to get Jessie to her game, but I can come back later.
My daughter plays ice hockey, and my wife had taken over the management of her ice hockey team. So this was the very first match that my wife was going to be in charge. And she was panicking because she had this game at 3 o'clock in the afternoon. So when she came to the hospital, all she was thinking about is, I've got to get my players onto the ice. So she actually had to leave within about an hour of me being in the hospital.
Blood clots.
Yeah.
Yeah.
You don't have the medication.
The speech is
Your
on.
speech could stay like that.
No.
You don't want it to stay like that.
No.
Laura's family are deciding whether to give her the clot-busting drug.
There's a
risk.
Yeah, there is a risk.
There's a small chance that giving it to Laura could put her in danger of a bleed on the brain.
Gabby, look at me. I've had such a good life.
It's not, my God.
I have
She's
had
not dying. What?
such a good life.
You're fine.
Don't cry. Please don't cry. Gabby. I'm not going anywhere. I'm not going anywhere.
Do you have a... Should we just...
Yeah.
Do you have any thoughts about what I've said? Because we need to crack on, because time is of
Yeah,
essence.
that...
I just think she looks fine. Would the speech not get better without?
It's got more chance with it.
So what do you think, Gabby? We agree for the medicine, no?
Gabby.
Yeah, but
Gabby.
you have to...
No risk.
Eh?
No risk. No risk. I don't want any risk.
You don't want any risk?
No, I don't want any risk.
Even if the benefits were more than the risks.
That would be up to my daughter.
Not
up to
both of them.
Both
together.
of them.
Yeah. Yes.
Before asking her family to make the final decision, a doctor will reassess Laura to see if there's been a change to her condition.
If you can hear and understand me, close your eyes. Put your left thumb on your right ear and relax. Point to somebody related to you. What is this?
A hand.
Close eyes tight, tight, tight. Open quickly. Show teeth. Open mouth. Stick tongue. Relax. So there's been a significant improvement.
Oh, yeah.
And so Just speaking about you, the speaking is better.
Yes.
Not perfect.
No.
You can see that.
No.
But we keep you in hospital still, we keep an eye on you.
Yeah.
We'll just every half an hour we'll check you
Yeah.
to make sure that, remember I was talking about the clot busting drug for 4.5
Yeah,
hours. If it stays like this, it gets better, great. If in the next few hours problems again, we'll have to rethink, okay?
Yeah, about the drug.
Yeah.
Yeah.
I think that's right. That's the right thing to do.
Despite a slight improvement, doctors will monitor Laura closely on the specialist stroke unit, as she's at risk of further strokes.
Hi, Toe. I'm really sorry to bother you, darling. It's the old bat. Are you okay? I'm down at King's. I've got a bit of a fluttery ticker. No, well, it's okay, and they're being absolutely brilliant. And I don't want you to go into panic, but what I would like you to do, I just wondered if you could go up sometime at about 11-ish, 10-ish, and let Chulu out.
Do you know how to put this up a bit more or not?
I should do it. Can you have that up a bit more, please?
Yeah, can I put it?
Sure.
Thank you.
Where do you originate from?
Philippines.
Philippines. Oh, I thought you might be Indonesian. Anyway, you're all lovely girls. You do great work over here, don't you? There's a lot of you.
Thank you.
Well done.
Nick has had a chest drain inserted to re-inflate his punctured lung and will be sent for a CT scan to check for other injuries.
Your wife had to go get kids, didn't she?
It's complicated. She's the manager of my daughter's ice hockey team.
Oh, no.
And they had a game that kicked off, faced off about 5 minutes ago. So she had to be there, otherwise the game would be cancelled and people were going from a long way. So, yeah, it's complicated. So she's done that. She's gone to the game, so not a lot she can do sitting there.
What age is your daughter?
She's 12.
12? Or is she quite good at hockey then?
She's very good.
Yeah?
My little son plays as well. It's the first introduction I've had to it. It's really good.
Mm-hmm.
In fact, I should have been taking my son to a game with Alexandra Palace this evening.
Oh, no.
I won't be there.
Aww.
Can you tell me what it means to you to have a dad that's a BMX champion?
It puts pressure on us.
Yeah, it's both an inspiration and a pressure, definitely, yeah.
Oh, it's one of the sons of Nick Priest.
They never say anything
This is
like
going to
that.
be good.
No, they never say anything like that. What are you on about? No, they don't say stuff like that.
We're going to get you around to CT. Right. Because at the end of the day, you've done this, so you could have done something else, and this would count as possibly a distracting injury. So it may be that you've got other injuries elsewhere, but because the pain of this is as much as it is, you're not necessarily going to notice things elsewhere, more subtle things. So that's the reason to get the CT.
So the pole. Worrying about myself is one thing, but worrying about the children is another. So when I watch my two boys go round, and they really go for it, and they do much higher jumps. Yeah, it does scare me. It does scare me that they're going to hurt themselves.
I wasn't happy with my upbringing. I used to love to go to school, hate to come home. I wasn't allowed to play with the boys. And there's nothing I like better than knocking a bit of wood together with a couple of nails and get hold of a knife and try and carve a shape or something like that. I was born in a workhouse at Watford. My mother put me up for fostering, and finally she'd put me up for adoption. I had to go to a solicitor's office in Reading. The solicitor said, hello, David. In the other room, through that door over there, you'll find there are two ladies, and one of them's going to be your new mummy. See if you can be a clever little boy and pick out which one it is. So I went through the doorway and there were two ladies sitting there. One was a nice round-faced jolly woman and the other one was a vinegary-looking woman. So I moved towards the smiley one and said, this one. And he said, no, David, try again. So I had to go away with the one I didn't like. And I never did like her. She was an elderly spinster, about 50 years old, a war widow. I managed to escape eventually when I joined the Air Force when I was 15. And I've never looked back. Do you want another little bite, Marjorie?
No.
I really feel that when I married her, that's when my family life began.
You want to come?
Should I not?
Marjorie is being taken for a CT scan to find out what's causing her eye pain.
You've been here as long as us, haven't you?
I was going to say, is it your wife who's here?
Yeah, she's had shingles on her, around her eye.
Horrid, yeah.
And she's got pain that she can't tolerate.
Yeah.
And she's had a cyst removed from the same place. And she's had one thing after another. Yeah. And this is the icing on the cake, isn't it? And they're just going to give her a CT scan on her head to make sure everything's all right.
Oh, dear.
Poor old thing. Well, anyway, I hope they sort you out.
Well, we shall hang on.
Yeah. You look all right.
No, well, it's what everybody says. It's just the beat's gone.
Have one of these.
Oh, you've got a pacemaker?
Yeah. Brilliant, they are.
He's got a pacemaker. But this is the thing that worries me. He goes down the road to get the paper, and I think he chats to absolutely everybody in Sydenham. And when he's not back, I really do worry about him.
How long have you had it?
7.5 years.
Yeah.
Yeah, they're brilliant. They take 15 minutes to fit.
Yeah.
And everything's lovely after that.
New man. Okay.
Yeah, good luck anyway.
Nice to chat.
And you.
He thinks I'm a bit cross because he's been gone for a long time, but actually I'm really quite worried about him.
Could you ever imagine your life without David?
Oh, don't. Oh, no, don't think about it. I just can't imagine it, no.
What is scared from you? Talk from you.
Poor you know me, I'm okay.
I never expected this.
Don't even think. Just think of the future. Life is a chain. You know, you cannot live forever. Someday, something happened to anybody. You have to expect that when you get over a certain age. You have to accept that one day everybody has to die. And it's sad, but it's what is life.
I love you, Camille.
Yeah, I got you. A stroke is a warning for better look after yourself and to enjoy together life until long as possible and then go.
Camille?
Yeah, somewhat.
You feel tired?
I feel very tired. But I don't want to be alone.
You're not going to be alone.
Don't worry.
Oh, there's hundreds of them out there.
No.
Are you going to be alone? They want to keep her here because apparently the next 24 hours
critical.
it can happen again, but more severe. To
My
reduce
problem might be my cholesterol might be high. All the cheese.
really rethink your diet now.
Because when she eat cheese, she had a whole packet. It's not like me, she had a few slices. She had a whole packet.
Feast or famine.
Small bread,
Just do it.
small whole packet. It's true. All bread cheese is already fat enough.
Yeah, maybe we'll cut out cheese for a little while.
Nick is back from his CT scan.
Nick, they're still looking at your scans. Okay, at the moment you've got quite a lot of rib fractures on the left side. 4th and then 8th through to 11th, essentially. Okay, so 8, 9, 10, 11. They are still looking at the rest of it. Okay, so they need to kind of just make sure that the rest of you is okay as well.
And if it was a wheelchair, then I'd have to do something like wheelchair rugby or wheelchair basketball. I couldn't stay still. There are some amazing things, actually, that you can do without being able to cycle. I was watching a guy the other day who was using a hand crank bicycle. Phenomenal, absolutely amazing.
We will admit you probably to our acute surgical ward if we don't find anything else. And I think the big challenge really is going to be your pain control. Yeah? Any questions for me at the moment? You just have to sit tight, I'm afraid, until we've got the scan results back before we can get you out of here. Yeah? Okay.
I very much live for the day kind of person anyway, so I could get run over by a bus tomorrow. So go out there and have as much fun as you can have.
Tired as well.
Yes, I am. I am tired now. No, we were up early, weren't we?
Oh, yeah, and you've been worried, I expect.
Oh, what have I got to worry about?
Doctors have ruled out any serious causes for Marjorie's eye pain. She'll be given pain relief and is being kept in hospital for observation.
Do you feel all right, do you?
Oh, yeah. Yes,
Just well, don't do anything at home, don't.
I'm not going to. I'm not going to do any ironing tonight.
No, don't do it.
I'm not doing anything. I'm just going to sit and watch the rest of the evening television. We talk about it. Said, what would you do if anything happened to me, Dave? And I say, oh, I'd be horrified, you know, but I could survive. And I've said the same to her. She said, well, I don't know what I'd do without you, because I am her sort of arms and her legs. Because she's not very mobile, I'll go out and get bits of shopping and whatnot. So we've been practicing buying stuff on the internet and various ways around. Yeah, we've got some plans afoot.
But they've said all that has gone.
Oh yeah, I know you're not in a.
And I think that's
you're not in an infectious state now, but you know,
I think that's the contagious
just to be on the safe side. But we said we're going to go together. Yeah, if one of us goes, then the other one will follow suit.
All right, then, done. Better, worse?
That's good.
Yeah?
Thank you. So, yeah, it's annoying with the season starting. Defending my crown again. I'll only be out for a month or so.
Camillo won't let me do anything, apart from cook. He loves me. I'm the cook. They've got to let me be me, as I was before. I think I'm nearly there. Nearly there. I lose my speech occasionally. I don't lose my speech, I get tongue-tied. I could have another stroke at any time. What I want, see my grandchildren happily married. I just want my grandchildren to have a good life like I had. Because I can't complain about my life at all.